Hello, in this presentation we will be discussing the pharmacology of the drug nitrous oxide. Generic names for this drug include dinitrogen monoxide and hyponitrous acid anhydride. One trade name is Afrox, but this inhalation anesthetic is most commonly referred to as nitrous oxide or laughing gas. It comes stored as a liquid in large cylinders about 1,590 liters and compressed to a pressure of 745 psi, which stays constant until no liquid is present in the cylinder. The following slides will lay out the mechanisms of action, effects on various tissues, side effects, and use of the drug in modern-day anesthesia. There is no one agreed-upon mechanism of action proposed for inhalation anesthetics. However, it is thought that nitrous oxide acts to inhibit the excitatory actions of the neurotransmitter glutamate at the NMDA channel receptor. The channel is opened by the binding of glutamate and glycine to two separate sites on the receptor. When open, the channel allows for sodium and calcium ions into the cell and potassium ions out of the cell. This channel is normally blocked or closed by magnesium ions, which are only removed by depolarization of the cell. Nitrous oxide interferes with the binding of the glutamate neurotransmitter, inhibiting its CNS excitatory effects and thus inducing its anesthetic and analgesic properties. As you can see from this diagram, nitrous oxide binds the NMDA receptor, not allowing calcium in or magnesium out. The major clinical effects of nitrous oxide deal with its ability to interfere with the binding of the glutamate neurotransmitter as seen in the diagram before. This inhibits the CNS excitatory effects and thus enables the drug to induce anesthetic and analgesic properties. Dosing of the drug. 1 MAC is the equivalent of concentration of agent at which 50% of patients will not respond to noxious stimuli. For nitrous oxide, the MAC value is about 104%. MAC is increased or decreased via a dial on the anesthesia machine to reach the desired level of anesthetic depth. Nitric oxide is described to have a quick onset due to its low solubility and quick equilibration with the partial pressures in the brain. Duration of the inhaled anesthetic lasts as long as the gas is being delivered to the particular depth of anesthesia wanted or needed for the effect that is being used for. Elimination depends on the same qualities involved in the onset of the anesthetic. A lower solubility enables faster elimination as the agent does not want to stay bound to the blood. The major route of elimination is the lungs, thus faster ventilation, adequate pulmonary blood flow, speed reduction of the brain's concentration of the agent, thus recovery. Furthermore, the longer the agent is delivered, the longer the recovery time will be. Nitric oxide is rarely used by itself since it's over 100% concentration it takes to reach 1 MAC. It has anesthetic and analgesic effects and is often used in dental procedures. It is often combined with other anesthetic agents to decrease the amount needed of the other agent. By combining with other agents, it can also decrease the degree of hypotension caused by other agents by its ability to increase sympathetic tone. Since nitric oxide expands closed spaces in the body, some contraindications include pneumothorax, blebs, air embolism, sitting craniotomy, bowel obstruction, and tympanoplasty with grafting. The expansion of parts of the bowel can lead to post-op nausea and vomiting. Additionally, diffusion hypoxia may occur upon discontinuation of nitric oxide as the concentration gradient causes displacement of oxygen in the lungs. Lastly, nitric oxide is known to inhibit methionine synthase, causing reduction of DNA synthesis, leading to the possible tetragenic effects in the third trimester. Listed here are some links for you to go explore the drug nitric oxide further.